Now, of course, as always, we enjoy hearing what you, the viewers at home, have to say. So earlier this week, we asked you, do you agree with the Texas Parks and Wildlife's decision to close the oyster bays? 40 of you said yes, and 24 of you said no. We also asked, should social media platforms ban graphic content, including videos/photos of shootings? 123 of you said yes, and 30 said no. Now, be sure to come to crossroadstoday.com/vote to participate in our viewer poll. All right, welcome back. We are now joined by the CEO and physical therapist for PAM Health. All righty, guys, thank you so much for being here. So, National Diabetes Day, which so happens to be today, right? Tell me a little bit about it. What are some signs about diabetes that people should look for if they don't know they have diabetes?
Yeah, I think it's really important to note that Victoria, we have about a 15% rate of diabetics in our population. Many of those have no idea, so it's really important to know the signs. So some of the things might be a decrease in sensation of one's feet, feeling of just not being well. Of course, going to see a physician, checking that A1C, it's one of the most important things, monitoring that and making sure to stay on top of that for sure.
What do you mean look out for signs in feet when it comes
to
diabetes?
Yes, so one of the symptoms of diabetes is peripheral neuropathy. So there'll be nerve damage in the potentially hands and the feet for sure. So basically the nerves start to kind of deteriorate because of this condition going on with the diabetes. So there might be a loss of sensation, some tingling, some itching, some burning, some kind of symptoms that are a little unusual with your feet. Can be a really great early sign.
And how does the physical therapy play a role into all
So
this?
from the physical therapy side of things, my job focuses on mobility and restoring function. With diabetes, most people going undiagnosed for quite a few years, 5 to 10 years, the nerve damage can progress, and when you lose sensation in your feet, small wounds can turn into big problems. Also, with loss of sensation and strength, we can have impacts to balance, which can increase the risk of falls. My job is, of course, early detection, and then teaching people how to deal with this or make lifestyle changes to mitigate the damage in the future.
Gotcha. And I know there's type 1 and type 2 diabetes. Could you go ahead and explain the difference?
Sure. Type 1 diabetes is the body's inability to make insulin. These diabetics are typically diagnosed very early on, though it can happen later in life, and they're dependent on insulin injections. Type 2 diabetes is the body's inability or insulin resistance, inability to either use insulin or make insulin, and it's progressive. Some statistics say that 112 million Americans are pre-diabetic. In other words, these changes are already happening, and that tends to turn into diabetes in 5 to 10 years. So with type 2 diabetics, lifestyle changes, quitting smoking, increasing exercise can reduce the impact of the disease.
What are some vital pieces of information that patients should be aware about for their diabetes?
Always check your feet. That's probably the most important. Daily inspections of feet. In Texas, in the summer, never go outside barefooted. You could burn your feet without even knowing, without even feeling it, and that can cause serious problems. Have A1C checked annually, have an annual exam, and always have good fitting footwear, because injuries can happen either from stepping on something or from rubbing on your shoes. So changing your shoes frequently, once a year, and inspecting your feet daily. Those are critical.
Gotcha. Give me some misconceptions about people who have diabetes that you just want to clear out the way.
Misconceptions about diabetes, some of the myths and rumors. One, that you can reverse nerve damage. You can mitigate it, but typically it's not reversible. So once it's happened, we have to teach people how to deal with it.
It's a permanent thing.
Yes,
okay.
it's a permanent thing. And other misconceptions, diabetes isn't impacted by the food we eat. Well, it's highly impacted by the food we eat.
Yeah, I think the standard American diet, as they call it, in relation to being, like Rob was saying, smoking, being overweight, some of those things. And I think a lot of times people think that they're just inevitably going to have diabetes. It's very preventable. Just lifestyle changes with exercise, good nutrition, high fiber diets, all can help to turn that around.
Absolutely. Well, you guys, thank you so much for being here. I appreciate your time, and thank you for the work you do. Absolutely. Thank you guys. To learn more about today's guests and their stories, come to crossroadstoday.com. If you have a story idea, email me or the station. You can also catch Community Crossroads at crossroadstoday.com. Once again, I'm Karina Garcia. Enjoy the weekend, drive safe, and we'll see you all right here next week.